Did you know that schizophrenia is prevalent in between 1 and 1.5% of adult population? It is important to be familiar or understand the symptoms. A person's quality of life can be severely affected by schizophrenia symptoms. And these symptoms are divided into three categories, which are positive, negative, and secondary negative symptoms. For one, positive symptoms may be evident in the person's function where they may have hallucinations, illusions, delusions, and paranoia and not be able to determine what is real and what is not. Secondly, negative symptoms are not as evident, but relate more to core deficits where the person experiences anhedonia, meaning that they can't experience pleasure, affective flattening, isolation, and reduced motivation. In addition to these negative symptoms, there are secondary negative symptoms that may be a result of medication side effects. Cultural religious concerns are also an impact in people with schizophrenia. Social influence is impactful due to the stigma of mental illness, where people are categorized as crazy. People with schizophrenia may tend to hide the diagnosis to avoid discrimination or judgment. This causes social isolation, which also weakens motivation and adherence. It affects self-esteem due to the stigma and due to side effects such as weight gain, and effects from the medication such as drowsiness and tremors. Religious stigma is also a concern where schizophrenia may be an interpretation of a possession, or it may be, or religion may tend to cure through faith alone, or through spiritual rituals instead of medication. If you or your loved one have been diagnosed with schizophrenia, there is hope. The condition is treatable, and Seroquel is here to help you. Some of the medication benefits are that it targets both dopamine and serotonin. Seroquel is a brand to generic antipsychotic medication Quetiapine. It appears to be associated with no prolactin increase, avoiding severe side effects such as hematologic, which would attack white blood cells. Overall, Seroquel decreases negative symptoms and improves cognition. It is better tolerated long term, which promotes medication adherence. Some of the side effects may relate to constipation, dry mouth, cardiovascular, or hypertension. However, the percentage of patients affected by these side effects range between 4% and 7%. An analysis have found that 1 in 8 people with schizophrenia will benefit from Quetiapine or Seroquel compared to placebo. Seroquel is found to be appropriate compared to other antipsychotics. It has lesser severe side effects and may be a preferred choice. Effective for acute hospitalized adults. There is caution, or lower doses are recommended for elderly and medically sensitive patients. Quetiapine or Seroquel is not guaranteed for everyone. Ask your healthcare provider to see what's best for you. Ask for Seroquel. Understand the risks and the benefits.